Hello everyone, welcome back to Prama English. I'm Tuhina. So today we have with us the health economist from USA, Ajita Priyadarshini. Welcome ma'am.
Thank you.
How are you?
I'm good, thanks, Tuina. How are you?
Okay, I'm also good. Okay, so growing up in Karanjia, Mayurbhanj, your roots is in Odisha. So how's your journey as an health economist and the cultural ambassador?
Yes, growing up in Karanjia, Mayurbhanj, it was a beautiful experience, although it was a different experience than a city experience. As you all know, it's a very rural area at the time. My father, who was a government doctor, was posted there. So I went to school there, and that keeps me grounded because I have seen the rural Odisha, the real Odisha, and also I have studied in Ravinshaw College and Bani Vihar, so I have seen the city Odisha also. So that influenced my decision to pursue health economics in a way because my father was a doctor. So I have seen the health sector from a doctor's point of view, and especially from a poor state like Odisha, where at that time medicine, the health sector wasn't developed that much, right? So I have seen that, and with my economics background, I thought like this will be a good journey. Yeah. So I took that and I pursued career in health economics and outcomes research. As for the cultural ambassador, if you guys know, Mayurbhanj is a cultural melting point, right? Mayurbhanj has chow, it has Odissi dance, it has drama. So I used to participate in all the dance and programs, and I also used to do the theatre in Odisha also, and I used to go all the jatra, opera, pala. So I absorbed all the cultural activities of Odisha, and I took it with me. So I pursued that in US as well.
So you have an incredible studies, well, a journey in UK, US, and India. So how you pursue that? Like, how's the changes?
Yes, that is an interesting story actually. So when I graduated from Bani Vihar, I applied for a position of health economist in Odisha. Okay. So I was straight out of college, and there was this position in a policy think tank, and I got that job, and I got actually exposed to health economics, and through that I went to UK, to University of Yorkshire. Okay. I was going to do a PhD there, but I got married. The circumstances took me to US, but I didn't forget my studies. I pursued that again, and I did a couple of masters there, and that's how this journey began.
So can you please share your experience in Vision 2010?
Yes. So when I was working as health economist in the policy and strategic planning unit for Odisha government, back in the days it's 2000, 2001. So we were working on the Vision 2010 for the health sector of Odisha. And there were organizations, national, central, international organizations coming to help us. And I was working with economists from UK, Scotland, US, and also some from Delhi. I also had the opportunity to actually investigate at that time. It's a mobility program to nurses in rural Odisha, where we were giving them mobility access so that they can go and provide prenatal care to the pregnant women in Odisha, rural Odisha, especially in the jungles and very remote Odisha where there is no public transportation, no buses, etc. So those actually shaped my views towards women health and health economics as such for a state like Odisha. And I am proud to say that I was part of one of the chapter in the Vision 2010 document that was published around that time.
So how's your work experience in global organization in US?
I have worked in multiple global organizations, also US state government and research foundations as well. It has been varied an enriching experience because I have seen their policy point of view for their health sector, especially in New York State Department of Health, where it is very progressive. Then I also worked as a health economics outcomes researcher for a data science company, where I did hands-on data analysis for the patient data in that company. Also, I did offering management, strategic planning in the real-world evidence field. It has been very enriching and very learning experience for me so far.
What can be done for the Odisha's development as an NRI point of view?
Recently, I attended the 18th Pravasi Bharatiya Divas that was held in Bhubaneswar, and I got a lot of ideas from that. And as an NRI, I think we have a lot to contribute to this state. Yeah. And as an Odia, proud Odia, I think I should be doing more, and I appeal to my friends that we should be doing more. For example, from health point of view, we can develop the telemedicine in Odisha. We can develop medical tourism in Odisha. Apart from that regular tourism, we can do make sure that we preserve our authenticity, but we also provide safe and affordable tourism to others, so attract tourists from outside India. I also have a lot of ideas about how to promote Indian art and culture, especially Odisha art and culture, even food. For example, when in America people ask me, Americans especially ask me, what is your favorite restaurant, Indian restaurant? I sadly said no, not a single restaurant comes to my mind. Why? Because most of the restaurants serve, especially North Indian or like Western Indian food, no one serving Odisha food. So I'm thinking, okay, if we can promote that, so entrepreneurs from Odisha can go and open up restaurants all over the world serving Odia food, Odia like pitha
Culture
and all,
and yeah.
that would be really nice. Also, I would say NRI can actually contribute a lot in mental health field. I know a couple of my friends from Australia, they have started a charitable organization in Khandagiri called Vudyam. They are providing support to mothers with kids who have intellectual disability. They are providing accessible support, they are providing speech therapy, physiotherapy, occupational therapy, and special education for these kids. So there has been a lot been going on here, but I think we can do more.
Okay, as you have said that you have attended the Pravasi Bharatiya Divas and your experience is much nice.
Yeah.
So, apart from this part, what do you love the most?
It was really well organized, and I met so many people from different countries, so it was really good. I liked the plenary sessions where they focused on women empowerment in one session, then cultural empowerment in another session, and also there was a session with the chief minister who declared that NRIs can be the third engine for Odisha
Yeah, yeah.
development, so I got excited about that as well. So all in all, it has been really great experience. But I think we can do more. And sometimes I feel like after we attended this conference, then what? So there should be something to connect us. So if there is a portal where we can all communicate and we have ideas and we can share ideas and maybe share ideas with youth of Odisha or mentor them or advise them or some way contribute to the development, that would be great.
So, you have been living 21 years in USA. So, is there any changes you have seen in Odisha?
Of course, I have seen a lot of changes actually. For example, in Bhubaneswar, I've seen beautiful flyovers and hand painted flyovers, wider roads, fast track roads like the national highways. A lot of educational institutions have come up. A lot of health institutions have come up. Malls and branded clothings have come up. All the I feel like it has changed a lot.
Okay, so any changes you want to implement here, like in US, you have seen?
Oh yeah, there is one thing that I would love to see in Odisha is as I have elderly parents who are aging. I have seen in US there is a system where people can age at home. For example, there are programs where they provide functional assistant to elderly who are at home. They are not in a old age home, and their kids don't live with them, but they can help them. Also, there are Meals on Wheels type program where they will come and give you warm food 3 times a day for the older people, so they don't have to go to old age home. And also I have seen like there are a lot of ramps in every organization, every building in US should have a ramp for elderly and disabled persons. So I want to see that in Odisha. Every place they should have accessibility, they should have proper healthcare, they should have some safety network to age at home as well.
Thank you so much, ma'am, for sharing such an amazing and interesting things with us. Thank you so much. This is Tuhina signing off for the day.